Hi, and welcome to this edition of Coronavirus TV. My name is Anna Osborne, and I'm a principal consultant here at Informa Pharma Customer Intelligence. Today, I want to address a few key questions about COVID-19 that are sort of at the top of people's minds at the moment. And I want to tackle these questions by looking a little bit at what we already know about other viruses, especially other coronaviruses. So there are three key questions that I want to look at today. So the first one is, can you get reinfected with COVID-19 straight away? Secondly, what happens if the virus mutates? And finally, how long will immunity last after initial infection or vaccination? So firstly, can you get reinfected with COVID-19 straight away? So it's generally the case that viruses that cause acute infections do grant people immunity to that virus for some amount of time. So this is the case with COVID-19's nearest relatives, so the SARS virus that originated in China in 2002, and also the coronaviruses that caused the common cold. And experts think that COVID-19 is no different. And so initial infection does grant people immunity for some amount of time. So then, what should we make of these reports of people being reinfected? Well, obviously, there's still a lot to learn about this virus. So at the moment, no possibility can be eliminated. But based on what we know from other viruses, experts do think that it's unlikely that people would have been reinfected after having cleared the virus. So they think that a second positive test result might be explained by the fact that many viral infections can continue to produce detectable RNA long after a patient has recovered without actually being contagious. And of course, there's always the possibility of testing errors. So the diagnostic tests typically rely on patient samples pulled way back from their nasal passages, and collecting that specimen is not foolproof. So testing a sample that was improperly collected could unfortunately lead to a negative test, even if that person had the virus. So the second key question that I want to look at today is what happens if the virus mutates? So firstly, all viruses mutate, so that's just their way of evolving. So they replicate like imperfectly inside a host cell, and then this results in the accumulation of mutations over time. And then some of the resulting mutations persist through natural selection. And viruses like the flu virus, the influenza virus, they accumulate a large number of mutations in quite a short space of time. And this means that they evolve relatively quickly. And because they mutate and evolve relatively quickly, this means that they're able to evade our vaccines. And this is why we need a new flu jab every year. What's promising so far with COVID-19 is that relatively few mutations have been observed. So there are only quite small differences in the strains of the virus that are circulating in different parts of the world. And so that's quite encouraging. And so that sort of relative stability suggests that the virus is less likely to become more or less dangerous as it spreads. And it represents encouraging news for researchers hoping to create a vaccine. So that leads us on to our final question for today, which is how long will immunity last, or would immunity last after initial infection or vaccination? So will we be protected for life? Well, viruses typically vary quite widely in terms of the immune response that they elicit. So for instance, if you've got chickenpox as a child, you are likely to be immune to reinfection for the rest of your life. With whooping cough, immunity might last for about up to 20 years, they think. When it comes to COVID-19, because this is such a new infection, we're not sure at the moment how long protective antibodies remain. And because we're not sure, our best predictions at the moment have to come from looking at the viruses most closely related to COVID-19. And what's slightly worrying is that with the seasonal coronaviruses that cause the common cold, researchers think that immunity fades after only perhaps a few months, which is why they think that you can pick up new infections year after year. And then the virus that's most similar to COVID-19, which is the SARS virus, in patients that are infected with that virus, research suggests that antibody levels peak, I think, between 2 and 4 months after infection, and offer protection for about 2 to 3 years. So immunity against COVID-19 could potentially only last a year or two, and so that means that even if most people do eventually become exposed to the virus, it's likely that their immunity would wane over time, and I think that's just another reason why the development of a vaccine is just so imperative. So that concludes this episode of Coronavirus TV. Thank you so much for listening, and we look forward to seeing you next time. Thank you.